And would Ryan, would you like to make any comments? Would anyone care to make any comments before we simply to present it officially in any way? I can say I could just go to making the motion and then we can get a first and second and discuss, or did anyone on the staff want to make any comments in the presentation before I ask for the motion?
I was just going to point out that we're keeping it's a flat rate from last year. We're keeping it exactly the same. I think that's the biggest thing. It's
yes,
that's good news.
It's great news, and that's why I said it looks good. So then we will go right to the motion.
I have a question.
Yes.
If I could, I noticed on there, we're assuming a projected, flat, premium equivalent to 2020. Is there any way to better determine what that forecast potentially looks like after the most recent open enrollment? I know we're going into the special enrollment and that can kind of change some things as well, but if membership increased or with a little bit of premium increase, are we expecting that that amount to be greater than it was in 2020?
Sure, I'll let Jennifer. Are you able to your audio?
Hi, yes.
Great.
Can you guys hear me? I've got two different connections going on, but Jennifer Krupp for the record. Thank you so much, Board Member Johnson, for your question. So I'm the CFO here at the Exchange, and so in response to your question, we do base our carrier premium fee adoption information off of our plan year 2020 actuals, as we have done for each year, but our projected plan year 2021 revenue is looking at just over 13 million for the year. And then actually these are fiscal year projections, but let me go over to our plan year projections for you. So our plan year 2021 projected premium revenue was actually looking at $14,143,761. We are projecting that flat through plan year 22 through plan year 25. The reason for that is that there is so much uncertainty, especially with the pandemic that is happening in terms of how that will impact premiums. There are, especially here in the state of Nevada, fluctuations with enrollment that could drive that up or down. We also take into consideration expected rate increases, and if there happen to be any changes in the ACA, which right now there are some changes that are happening, but they look like they would be positive impacts to state-based exchanges, our exchange in particular. So, and we really don't have information related to potential rate increases for a future plan year. So that's dependent through the Department or the Division of Insurance and their rate setting procedures that we'll have information on later this year. So.
Perfect. Thanks for the insight. I
You're
just think
welcome.
it's interesting how we have to manage within the budget and that sort of thing, and increased membership, great thing, right? Ensuring more Nevadans, and I know that with that comes additional expense to provide the customer service and the experience that they need. And I think it's remarkable what Nevada is doing with its own exchange and the technology, and the fact that we can keep that rate the same and kind of adjust as we have those changes in membership is fantastic.
Well said, Jonathan.
All right. So,
okay, then I will go ahead and go ahead.
No, I had a question to piggyback off of Jonathan, just again for just curiosity, not to change
yes,
anything that we're
voting
for. But Jennifer, in that same vein, I know it's incredibly difficult to forecast and again in these times, but are there any things that in the foreseeable future, I know you mentioned something about this being projected out to 2025 potentially at this point, but is there anything that would make us have to come back and say, okay, we need to make some adjustments in another emergency meeting, and if so, is that an option for us? Or are we sort of locked in once we, decide?
Thank you so much for your question, Board Member Branch. Again, Jennifer Krupp for the record. we don't see anything in the foreseeable future that would require us to change the carrier premium fee to move it either up or down. That is something that, to the best of our ability, we do try to predict the future. If, you know, I joke sometimes that that's my job, is trying to predict the future, but if there were something that were catastrophic or emergent, honestly, we would probably just have to figure out a different alternative, because our carrier premium fees are directly impact the rates that our consumers pay for the insurance policies that they purchase off of the exchange. We really have to be very prudent, and we have to do our absolute best when it comes to changing these carrier premium fees. So we really wouldn't be able to adjust these fees again until plan year 2023.
Mm-hmm. Thank you. And at least if it was an emergent, unexpected, catastrophic event that you couldn't even foresee, then at least it sounds like we don't have to wait till 25, but it could be addressed in 23, which is good to know. So if any other questions, comments, otherwise we'll go ahead and I would say we would want to have a motion pursuant the regulation. It says EX-04-A to adopt the 2022 fees to be charged to insurers. And does this need to be modified, having said what we just said, 2022 through 2025?
No, again, board member Johnson, this is Jennifer Krupp for the record. This is just for the rates for plan year 2022. So to clarify, we do project our potential revenue out through, at this point, plan year 2025, but the motion at hand is only for the plan year 2022 carrier premium fees.
So the motion to adopt the 2022 fees to be charged to insurers and adopting a 3.015% of the pre-subsidized premium fee for qualified health plans and standalone dental offered on the exchange. Do I hear a motion?
So moved.
Thank you, Quincy. And a second.
Jose Melendez, second.
Thank you, Jose. And if everybody would like to say in favor, aye.
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 Excellent. And is there any opposition? I did forget after second motion to ask if there were questions, but I apologize. I think some of that was done prior. So before I ask the final, anyone abstaining or call it, did anyone have any further questions? Okay, so no opposition. Was there anyone abstaining? No, so it is passed unanimously. So the motion to adopt the 2022 fees to be charged to insurers, adopting the 3.05% of pre-subsidy premium fees for the qualified health plan and standalone dental plan on the exchange is passed. And I will echo Jonathan, excellent job being able to maintain these with all the changes going on. And great job to all of the staff. So moving on, we have update on our 90-day special enrollment period.
Great. Thank you, Dr. Jameson. I'll take this. Okay. So on January 28th, 2021, the President of the United States issued the executive order on strengthening Medicaid and the Affordable Care Act. Section 2 of this order directed, in light of the exceptional circumstances caused by the ongoing COVID-19 pandemic, the Secretary of Health and Human Services shall consider establishing a special enrollment period for uninsured and underinsured Americans to seek coverage through the federally facilitated marketplace. Pursuant to this order, the Center for Medicare and Medicaid Services released a press release on February 12, 2021, announcing that a special enrollment period, an SEP, for healthcare.gov would officially be available to consumers starting on Monday, February 15th, and continuing through Saturday, May 15th. Shortly after the executive order was released, the Silver State Health Insurance Exchange, the state agency that oversees the online health marketplace, known as Nevada HealthLink, immediately began discussions and planning with our enrollment and eligibility vendor, Get Insured, to make the necessary technology changes to the exchange's platform to mirror CMS's timing for the SEP. Between the announcement of the executive order and the launch of this new SEP at 12:01 a.m. on February 15th, the exchange's policy and compliance team, quality assurance team, and reconciliation team, in collaboration with Get Insured, was able to design, implement, and test platform changes that would ensure, one, that the SEP would run on those dates, February 15th to May 15th. Two, that the existing qualifying life event, the QLE, the missed OEP SEP, shall be configured to be used by consumers one time who do not have an active open enrollment that are applying for coverage outside of our traditional open enrollment period. And three, that the QLE life event, will allow an effective date the first of the month following the plan enrollment. If the consumer does not shop within the provided shopping window, an SEP denial notice will be generated and sent to the consumer. So those were our basic rules of engagement that we had to develop and test. While the aforementioned business requirements were relatively short, testing was critical to ensure a smooth customer experience. User acceptance testing was a focus in the days leading up to the launch. Ultimately, testing revealed that minimal adjustments were needed to the system. The system was launched at 12:01 a.m. on February 15th, and the exchange is excited to report that in the first week, the exchange will have approximately 500 new consumers enrolled in this SEP. Now, I just looked at numbers today. We're almost knocking on 1,000 new consumers since the 15th of February. As with all exchange open enrollment periods, the special enrollment period launches. As it launches, the exchange pays special attention in the first few days and weeks to what we are hearing from our broker community, our navigator community, and call center staff. Due in large part to the time invested in the detailed user acceptance testing, we have yet to hear about any large systemic issues or concerns. Enrollments and eligibility rules appear to be working as expected. Now, regarding marketing and outreach for this special enrollment period, as the board knows, the exchange takes the long view to planning and executing our marketing and outreach plans. The executive order and accompanying SEP was late-breaking news, but our marketing team and partners at Penna Powers and the Warren Group quickly provided a game plan to message consumers about this new enrollment opportunity. The messaging was to be simple and direct and move away from previously planned QLE messaging, since this OEP could be open to new consumers without needing a specific QLE reason. Current messaging for this SEP includes, are you insured? Nevada HealthLink is here for you. Get peace of mind. Nevada HealthLink is your resource for comprehensive health insurance coverage. And think you can't afford to get covered? Nevada HealthLink is the only place Nevadans can qualify for financial assistance to help pay monthly premiums. 4 out of 5 enrollees qualify, and some enrollees pay $0 out of pocket each month. So once the exchange knew the what we were going to message, the next question was the where. It was decided that the exchange's best strategy as where to market messaging regarding this SEP would be paid search, display advertising, email campaigns weekly, social media, stakeholder promotion and cross-promotional opportunities, community relations and messaging through community partners, and continued delivery of resource guides throughout communities. Lastly, it should be noted that a big factor in supporting this SEP is the Get Insured call center. The call center was able to accommodate opening and servicing consumers and our enrollment professionals on Monday, February 15th, which was a holiday and a previously scheduled day off for our call center staff. The agility and flexibility shown by the Get Insured call center to be able to pivot and staff not only on the February 15th holiday, but looking forward to May 15th, which is a Saturday and another previously scheduled day off, is a testament to how the exchange's partnership with Get Insured is consumer focused in striving to achieve the never-ending goal of helping uninsured and underinsured Nevadans gain affordable, comprehensive, and qualified health insurance coverage. Our messaging and the excitement of this new opportunity proved effective. In the first week of this special enrollment period, the February 15th to May 15th, the call center's volume was up 25% over the previous non-SEP week. And that's our quick update on this. I think you're on mute, Dr. Jameson.
That is a report filled with a lot of glowing and reassuring information. It is really fabulous how you guys were literally, all of you, able to just pivot, turn around, and just get it started again with minimal changes needed, and to have just great, be running well, smooth. And it's so marvelous with our new platform that you literally have live feedback instead of hearing from the federal government months later how things went. This is so exciting to have live feedback and to be able to say that there virtually was none. And also to hear about how much this really is needed by our Nevada community because of the increase in enrollment that you're seeing. So well done, and service needed. And it's so, as we all have dedicated, this time and our commitment and support of this, it just reaffirms us that we are here because we are so needed by our Nevadans for access to quality healthcare. And I know every one of the board members who is also committed to access to quality healthcare just gets thrilled when they hear a glowing report like you just gave us. So thank you. And I'd like any other board members to feel free to comment.
This is Jose for the record. I just want to say great job, Ryan and team and Janelle and everybody for turning things around so quickly and responding to our new president's initiatives. So I was happy to see that, and those numbers are awesome. So good work, everybody.
Thank you.
I had a question if any other board members have any comments.
I would just echo, great job, you guys. Just year after year, you guys are very, very impressive team. So good for you.
Thank you, Valerie and Jose. What I was wondering was, I know we're going to have some new PR media, and I was just wondering when that starts.
Sure, I think Janelle's on the call. Janelle, you want to take that?
Sure, yes, I'm here. Janelle Davis, Communications Officer for the record. Yes, we have already started all of our PR and digital and search advertising for this campaign. We didn't add any budgetary items to that, but we started as soon as we could and just kind of tweaked our budget and messaging basically when the SEP started, which was February 15th.
Very good. I appreciate that because I'm sure that a lot of the success, as we know, it's all about awareness and getting it out there, which you've just done an amazing job at doing. So again, kudos to you, because, without this great media exposure, the wonderful campaign and slogans, taglines, and just being on the out there in all the different ways you do it, we couldn't have these fabulous results. So again, thanks to the team for that as well. So if there are no other comments, then we can go on, and we have here discussion of possible action regarding dates and times of our future agenda. And is there anyone there that actually knows the date of the next meeting, so all our board members can mark that in?
I do have that. I'm just pulling it up right now. Give me just 1 minute. I believe that is going to be June. Hold on 1 second, please. Yes, June 24th at 1 p.m.
Very good. June 24th, 1 p.m. Everybody has that. Does anyone on the board have any particular follow-up on our usual items or new items that pertain to what's going on that's new? that you would like to have staff add to the next board agenda? Well, I anticipate they're going to be giving us another report on the special session, so I'm sure that's just going to be in there. And I guess we might hear at that time from the new PR team, I would imagine. And that's the things I'm just excited to hear about. Anybody else have any questions, concerns? Excellent. Yes.
Yeah, I was just going to ask if it would be possible, and I don't want to rock the boat, but if it would be possible, I'm now serving on the board with the health district on their community health center, and as you all probably can imagine, we're very busy and crazy busy with all the pandemic and everything that's going on, and they decided to, of course, set those meetings on the same day as this meeting on the months that we meet. So if there's any possibility that we might look at maybe a start time of 12:30, but if it doesn't work for everybody else, then we can leave them at 1 o'clock. But then I'm running into a situation that I have to be off the call at 2 o'clock when those other meetings start, because again, we're just dealing with so much right now with the pandemic and everything that we're on the ground doing from the School of Public Health and other areas that I'm involved with right now. So just as a possible consideration for these meetings, if there was the ability to start at 12:30 on the days that we do meet, but again, if it's too much of a hassle for all the other community board members, then leave it where it is and I'll just make it work on my side.
Jose, thank you. Jose, these are extraordinary times with COVID and everybody is having a lot of conflicts in schedule and we respect that. So why don't we just ask staff, maybe what they can do is send a monkey doodle out to all the staff all the board and staff members and see if 12:30 is accommodating or if it's best for everyone to stay at 1. We definitely won't go back to 1:30 where we were for years. That would be worse for you. So why don't we just do that? And then we'll let the staff get back to us. Thank you for bringing it up, Jose.
Thank you, everybody, for your consideration of that.
All righty. Public, because that's what we wanted to hear about, timing, dates and times. So very good. So any public comment? Let me know if you get anything on your email chat or however you guys have people reaching out to you.
Yeah, I'm going to go ahead and open up the lines for all the attendees. Give just one moment. Okay, so the phone lines are open for anybody. So if anybody has any questions, you can go ahead. And I'm not seeing any on my end.
No questions and no comments. All right. So that would end public comments and I would be happy to entertain a motion to adjourn.
Valerie Clark, so moved.
Jose Melendez, second.
All right, that's all we need. So we'll go ahead and adjourn. And I look forward to seeing everybody on June 24th, either at 12:30, 1 p.m. as is to be decided. Thank you, everybody, so much and have a great afternoon.
Bye, everybody.
Thank you.
Stay safe.
Good to see you all.
Thank you, everyone.